Hello everyone, we are Group 4 and my name is Jessica. I will be getting us started. Research shows that communication breakdowns are a top cause of medical errors and patient harm. A review of 23,000 malpractice claims found that over 7,000 were tied directly to poor communication, costing around 1.7 billion and 2,000 avoidable deaths. The Joint Commission International also highlights major risks like inadequate handoffs, low health literacy, and cultural mismatches. Taken together, these factors increase the likelihood of preventable harm and even episodes of workplace violence. In this presentation, we will explore how we arrive here and where we can go next. Historically, healthcare in the U.S. was a simple cash or buy system, but as costs rose, multiple payers and referral rules emerged. This complicated administration and increased the chances of misinformation. Real-world studies confirm how seemingly small lapses can spiral. For instance, cancer-related fatigue remains undertreated due to minimal provider awareness. Furthermore, communication gaps can also fuel hostility. In Palestine, 59.6% of reported violence toward healthcare workers was verbal, often arising from feelings of disrespect. Meanwhile, language barriers triggered a near miss with a non-English speaking patient in the UAE. Ultimately, these examples reflect the same root cause: incomplete, unclear, or culturally mismatched communication. Despite extensive documentation of the problem, the following question still remains. How do communication failures between healthcare providers and patients, as well as within interdisciplinary teams, contribute to medical errors, and what strategies can be implemented to improve communication and enhance patient safety? In the next sections, we will dive deeper into these issues, explore theoretical frameworks that explain communication breakdowns, and offer evidence-based solutions. Ultimately, we'll look at practical steps healthcare organizations can take to transform miscommunication into consistent and reliable information exchange. Thank you, and let's continue.
I'm going to talk about a phenomenon that is constantly overlooked, which is patient-provider communication. These everyday conversations shape how safe patients feel, how much they trust their care, and even whether they survive certain conditions. Clear, empathetic communication is not an option. It is something that is necessary and it's life-saving. When patients are overwhelmed by medical terms, when their cultural needs aren't considered, or when their symptoms are dismissed, it doesn't just lead to frustration. It leads to misdiagnoses, delayed treatments, and ultimately silence of patients. These gaps don't happen because providers don't care. They happen because empathy, time, and cultural competence aren't always built into these systems, but they should be. When people don't feel seen or respected, they tend to disengage. They skip medications, they don't follow up, not because they're difficult, but because they don't feel safe. I've experienced this firsthand. Before I was officially diagnosed with postural orthostatic tachycardia syndrome, I had chronic symptoms that were invisible: fatigue, dizziness and fainting, and pain all over my body to the touch. And providers constantly brushed them off or chalked them up to anxiety. It made me feel like I had to convince people I was telling the truth just to be taken seriously. Because of this, it took 6 full years to get diagnosed and properly treated. That kind of dismissal doesn't just make you feel small, it teaches you that your pain is negotiable. And patients who don't speak English fluently, they're often left out of critical decisions about their own health. Same care plan, and completely different experience. Fixing this starts with better training. Providers need real practice in listening, like actually listening and recognizing when a patient feels shut down. Tools like checklists and reminders help keep things from falling through the cracks, especially when time is tight. And tech can make education more accessible between visits. But most importantly, the system has to value connection just as much as credentials. Better communication means better care. It is that simple.
In healthcare, communication isn't just about talking. It's directly tied to patient safety. When teams don't communicate well, the risk of medical errors goes up. There are three common breakdowns we see. Role ambiguity. When people aren't clear about their responsibilities, tasks can get missed or duplicated. Hierarchical barriers. When staff feel too intimidated to speak up, especially around doctors or senior leaders. Ineffective handoffs. When important patient information gets lost between shifts or departments. These aren't always individual mistakes. They're often system issues that make errors more likely. A powerful example of how dangerous hierarchy can be is the story of Josie King. Josie was a healthy toddler recovering from burns at Johns Hopkins. Her mother noticed signs of dehydration and infection and raised concerns. Some nurses agreed, but no one felt safe enough to challenge the doctors. Josie tragically died from septic shock, a preventable death rooted in communication failure. This case teaches us that it's not enough to tell staff to speak up. Leaders need to actively create psychological safety, model listening, and support communication tools like SBAR to prevent this from happening again. So how do we prevent tragedies like Josie King's? It starts with building a culture of open, reliable communication. First, role clarity. Make sure everyone knows their responsibilities. This can be done with clear protocols, checklists, and daily huddles. Second, flatten hierarchies. Encourage questions, listen actively, and create a space where everyone feels safe to speak up. And third, structured handoffs. Use tools like SBAR or iPass to guide patients. iPass is especially useful because it covers illness severity, patient summary, action list, situation awareness, and synthesis by the receiver. Practices like regular huddles and active listening training help reinforce these strategies, keeping teams aligned and patient safe.
Effective communication is essential to safe, high-quality healthcare. When providers and patients struggle to understand each other, it can lead to misdiagnosis, errors, and a loss of trust. Much of this confusion stems from medical jargon, unfamiliar health situations, or cultural and language barriers. This is where communication accommodation theory, otherwise known as CAT, comes in. CAT explains how providers can adjust their communication style, like simplifying language or mirroring a patient's tone, to improve understanding, reduce anxiety, and build stronger connections across cultural or linguistic gaps. One way this is demonstrated is providers using simpler language, being more mindful of tone or body language, or respecting cultural background, all of which help patients feel understood and supported. This theory also reminds us that while adapting is helpful, going too far, like oversimplifying, can sound condescending. Ultimately, this theory encourages providers to meet patients where they are. This theory also explains why communication can break down within healthcare teams. The theory focuses on how people adjust their communication, or don't, based on role, status, or group identity. In teams, this plays out when professionals fail to adapt language, tone, or behavior across disciplines, leading to misunderstandings. It also highlights how power dynamics and hierarchy can prevent open communication, especially if some voices feel less heard. By recognizing these patterns, teams can become more intentional in how they collaborate, improving both communication and patient outcomes. To improve healthcare communication, we need strategies that address how critical information is shared across teams. The hidden profile paradigm shows that team members often hold unique information that goes unshared, yet this information can be vital to patient care. For example, Report 1 contains a full breakdown of the patient's symptoms and diagnosis, including diabetes and high blood pressure. But during a rushed shift change, Report 2, the version handed off, lacks that detail entirely. This kind of information loss can happen when staff assume something isn't important or don't have time to explain everything. But without full context, treatment decisions may be incomplete or even harmful. The hidden profile paradigm reminds us that improving team communication isn't just about more information. It's about sharing the right information at the right time.
Let's take a look at how communication failures in healthcare teams can lead to serious medical errors. Poor communication is a leading cause of sentinel events, which are unexpected incidents that result in serious harm or even death. 3 common issues include role ambiguity, where tasks are missed due to unclear responsibilities, hierarchical barriers, which discourage junior staff from speaking up, and ineffective handoffs, where critical information gets lost during shift changes. These are not individual mistakes, as they reflect deeper system-level issues that disrupt teamwork and compromise patient safety. Looking ahead, improving communication in clinical settings is essential for better patient outcomes and reducing errors. We can start by using structured tools like iPass and SBAR to standardize how information is shared, especially during handoffs. Creating psychologically safe environments also matters, as staff need to feel comfortable speaking up. Cultural competence is another key piece, ensuring communication is respectful and inclusive of all patient backgrounds. Lastly, we need to center communication around patient needs, making sure care is clear, collaborative, and personalized. Together, these steps can help build a safer and more equitable healthcare system. Improving communication in healthcare is about creating a stronger foundation for safer, more equitable care. It should be treated as a core function, built into policies, training, and daily practice. We need to monitor interaction quality, support provider education, and involve patients more actively in their care. As remote care expands, research should explore its impact on communication, especially for vulnerable populations. Ultimately, meaningful change requires strong leadership and a culture that sees communication as a shared responsibility that is central to safety and trust.